Hi everyone, so welcome to our next series of Free Your Mind. So our next webinar on that episode. So we've got Jags here from Conscious Physio and R&D Physio, who's he's a mindset coach and NLP trainer as well. And he's gonna talk about mindfulness. So over to you, Jags.
Hey guys, how's it going? So I guess to begin with, I'll just mention a little bit about mindfulness for those of you that don't know what mindfulness is. So mindfulness is essentially a tool that you can use, and it's essentially bringing awareness to the current moment. So complete awareness on the current moment. And there's many different forms of mindfulness. Meditation is well known. So this is something that's been practiced by many people these days, and it's probably the most well-known form of mindfulness. But there are other forms. So there's things like art therapy, where you can you're drawing and you're kind of bringing all your presence on the current moment whilst you're drawing. And there's various other forms. And in my current kind of work, I work with a lot of pain patients, so chronic pain patients. And often when they come and see me, there's obviously the physical aspect. So the aspect where you're injured and, you're trying to come up with a solution to finding how you can get better. And often when I'm working with those patients, what I often find is like a lack of mind and body connection. And this is where I bring mindfulness and kind of the mindset coaching as well. So a lot of my clients at the moment, although I'm working with particular exercises and movement strategies, I also use kind of the mindfulness and mindset aspect, where I work with anxieties and fears and help them overcome that. And I find often the biggest barrier is actually the mindset, more than the physical aspect of the injury. So overcoming the mindset and their fears and anxieties helps them actually move forward and get better with their injuries.
Cool. So I know you mentioned, treating your clients with in terms of anxieties and fears. Probably a bit of a wide question to ask, but you use mindfulness, but how are you implementing that? What stages, I guess, in that do you then help them to tackle the fears and anxieties?
Yeah, sure. So I guess it depends on each individual. And essentially I like to try and bring it in it like during the first one or two sessions. And the way I bring it in is, a lot of people come in and they've been given different exercises to do. For example, back pain. It's quite common. They go on YouTube and they do a lot of different exercises. And yes, they can do it, but they don't know what muscles they're targeting. They don't know what they're actually doing. And often the technique is wrong. And what I like to do is just a deep diaphragmatic breathing technique, where essentially you're breathing in deep and you're really paying attention to how your stomach moves up and down whilst you're breathing. And the idea is, of course, get them to breathe deep, but also to kind of create that connection where for the first time they're actually connecting to each different muscle groups and they're feeling how it feels to move in their body, if that makes sense. So moving on from that, I then take that kind of same technique whilst they're doing the exercises. So for example, if you're doing the bird dog exercise, which is quite used for back pain. And what I do is, whilst they're doing the exercise, I get them to breathe in deep and talk me through how they're feeling whilst they're doing the movement. So it's almost like I'm using mindful movement. And I kind of use that in the actual session. And then in terms of the coaching aspect, I find that often when you start talking about kind of anxieties and fears, people kind of tense up and they kind of become panicked. They don't want to talk about it and they feel a bit distressed. So using the mindfulness techniques, like within 5 or 10 minutes, I get them to relax their bodies and almost then start talking about their anxieties that way. And I often find that it's much more easier and more comfortable for them to speak about it. And also, it's also easy to see any kind of triggers that they may have. So yeah, that's how I usually implement mindfulness.
And what would you, or have you got any tips or what you would suggest for someone? Maybe I know you, because you've got them in that exercise mode, if you like, so you're able to kind of relax them. But what if you've got someone who's not in that that scenario or that situation, but you just want to help them to tackle their anxieties or fears, and instead of just speaking to them about it, like you said, if they tense up or anything like that, how would you kind of, or what advice would you give to kind of tackle that?
In terms of if they're kind of just anxious in general, or
Yeah, just general.
I guess with anxiety is different because it's a broad spectrum, right? And there's different types of anxiety. I guess in terms of anxiety related to movement or chronic pain, I think it's good to get clarity on why they feel anxious. So I think one of the first exercises I would do is kind of a grounding tool. So essentially the diaphragmatic breathing exercise. And the idea is just to ground them, to allow them to feel more calm. And often when the patients come in, that literally they're just kind of on the go. They're just like, I feel I've got this pain, I've got that pain, and they're just like literally just saying everything out, and they kind of go into this frantic mode where they're literally in their heads and they're like really panicked. They're it's a sympathetic nervous system, so they're like literally just on the go. So I get them to calm down. I would get them to calm down and literally use the mindfulness to kind of relax themselves, to relax their body and ground themselves. Following that, I would start to journal around what their pain is, why it's caused, and kind of the feelings around it. So, for example, a recent patient of mine that came in, like she had back pain for like 20 plus years, and she had gone to chiros, she had gone to like she had back surgery, she even had like breast reduction surgery because she thought that would help with the actual back pain. And what kind of happened over the years is like she's had so much information given to her, like she's become overwhelmed, and she hasn't really had time to sit down and actually process all of her thoughts, if that makes sense. So in that session, we just kind of sat down, we kind of showed her this breathing technique to allow her to just relax a bit more, and then got her to just start talking about all of her beliefs and kind of just jotting them all down. And then through that, we kind of went through a process of where we started to separate the facts that she knows is a fact versus something she's heard from other people or was given to her by other people. And through that process, we were able to almost realize that actually a lot of her fears were by people telling her certain things that may or not be true. So I would say if you're going through that process of anxiety, and especially around chronic pain, I would focus on building clarity with what you know is a fact. For example, we know that surgery can help, but at the same time, many people do come out of surgery and they still have that pain. And we know that first line of treatment should be kind of going to see someone to help provide you with a certain amount of exercises to help see if that helps. So that's a fact, right? So we would go through the facts and then separate that from fiction. So, example, some people might say, um, if you drink turmeric, that'll help with the pain, which might not be true at all, right? So it's like separating the fact from the fiction. Yeah.
Manisha, have you got any questions?
Jags, how do you know if your mind and body is disconnected?
That's a good question. It's difficult to know. I guess it's a subjective thing at the end of the day, right? But with a lot of patients that come in, they often ask questions like, am I doing this correctly? I don't know what muscle part I'm doing. I don't know what I'm like. They do a certain movement and they might be activating certain muscles, but they don't know what they're doing. So I guess in terms of that muscle, mind and body connection, I would start focusing on, say you're doing a hip bridge, I would focus on activating the glutes and getting them to focus on how that feeling is. So in that way, you're kind of focused on activating a certain muscle group and targeting it. So for me, that mind and body connections comes in when you are targeting a certain muscle group and you know you're activating it and you know how that feels. And that's how I would kind of perceive it.
And my second part to that question would be, what would you say the benefits are for somebody's well-being and mind in terms of being connected with your mind and your body?
Yeah, so often when we're going through our kind of day-to-day lives, so we're often so much in our heads, like we can get overwhelmed, we can get stressed, and kind of the benefit of building that mind and body connection is almost that kind of feeling of being grounded, that feeling of being literally connected to yourself, understanding what's working, understand what's not working, and almost like you have control of yourself. So often when you're moving through life and people are telling you do this, what happens is we feel disconnected and we reach out to external things. Often when we process things within ourselves and we kind of sit there and actually focus on what we can do, then I find that often many of my patients as well, they kind of feel that kind of stress-free life where they're almost disconnected from other things and they kind of connect back to themselves. Does that make sense?
Yeah, thank you.
Jags, I just have a question for you. So obviously earlier you mentioned about turmeric as being the fiction.
Yeah.
So it just brings me around to the Asian community and your experiences with people in the Asian community. And I know you're speaking about people who have anxieties and fears through their lives, and it tends to be with the Asian community, a lot of people tend to take things on their shoulders, and they do tend to be less sort of vocal about mental health and certain issues. So just wondering what your experiences are with people in particular from the Asian community.
Yeah, in the Asian community, there's a lot of things being thrown around. I guess a lot of people in pain often, I think the first thing they think is that they've damaged something. So I think that's like the common stigma. And I think a lot of people, when they go through that feeling, they've damaged something, they always look for like a scan, MRI or X-ray. They may not need it at all. So I think that's like the first thing, kind of misconceptions I've noticed. Like pain does not equal damage, and getting that message across is difficult for everyone, and not many people understand that. And then when they have that kind of fear, what happens is often many people think they look for quick fixes, and especially in the Asian community, like there's this thing looking for chiros to do manipulation, and I'm not against it. Like if it works, it works. But then at the same time, it's also looking at, like for one patient I had, she had 18 sessions with a chiro. Each session was 15 minutes to literally crack her spine, and after 18 sessions, she had no like improvement. So like literally, I would say within 5 sessions, she should have been able to see that. But I think there's like that Asian mentality where you're looking for a quick fix, and manipulation is one of them. Getting a scan is one of them. Often you don't need a scan to get healed. Those are the main two I can think of at the top of my head. There's also like other things like hot and cold therapy. So a lot of people like having water bottles or hot water bottles, which can be beneficial. And it's not a bad thing, actually. It can help with that pain management, but at the same time, doing that is not going to help in the long term fix that pain you may have. Often you may need to go through a rigorous exercise program. You may need surgery, but it's something to talk to the doctor with as well. And also the other thing is painkillers. So a lot of people do rely on painkillers, and the idea is that painkillers will help almost alleviate all your pain, and it might do, but in the long term, if you don't fix the underlying root cause, which is building that muscle mass, building that strength in whatever you've injured, you're not going to heal. And painkillers are most of the time a short-term fix.
Yeah. Okay. So it seems like a lot of it is just people need educating, don't they? On
Yeah,
this,
100%. Yeah, I think.
Yeah. Go on, carry on. Sorry.
So yeah, there is a lot of miseducation out there, and I think with doctors, especially with COVID at the moment, it's difficult for them because they've got so many patients, and probably most sessions are like 10-15 minutes. So I think it's almost giving out the opportunity for them to go out and learn about different conditions and educating them on the importance of taking time and kind of going through that rehab journey. And I think many people actually don't go through that journey at all, and they kind of given a painkiller and they think this is going to help them, but in the long term it actually doesn't.
Yeah, I think with the elder generation in particular, it's a lot of old wives' tales and things like that. So they take on things that they've been told from other people, and it gets passed down in generations, doesn't it? So yeah, I think, like you said, it's about educating. But how would you say, the best way to sort of educate people within the Asian community are in terms of these sort of different ways to approach them?
Yeah, I think at the moment social media is a big one. I think giving out content, and if you're kind of a healthcare professional, you work with sports, or you kind of in that kind of area, giving out information and kind of tailoring it so that you're not giving them the one fixed cure, because I don't think there is. I think with anything you're gonna have to go through different modalities, different kind of tools, and try different tools out to find out what's best for them. And I think it's important to explain to them that certain things will work, certain things won't work, certain things will work. And it's almost giving them that the importance of going through that whole rehab journey, and giving them that kind of like 3 to 6 months journey and approach versus giving them that quick fix. Because I think there was a lot of quick fix kind of social media, like people selling things like for quick fix. Like I know there's one thing where you kind of wear a vest for back pain. So things like that, and telling them that will help fix their pain. So like stopping things like that and giving them long-term fixes.
Yeah.
Yeah.
Okay, thank you. Veena, Manish, do you have another question?
I have a question following on from what you asked, Sabrina, which is, how would you convince a mum, a grandparent who's from a South Asian community that, if you have a cold, for example, that the haldi in milk isn't quite what you need, and actually you need something else, and similar to what you're describing with, with the whole idea around mindfulness and mindset, how would I convince my mum that actually those remedies and those methods perhaps are not the best? Because in their eyes, like Sabrina said, these are traditions and culture that they've grown up with. And I guess another part to the question is some of it's tradition and never being questioned, and they feel it works because psychologically they've trained their mind to believe that it works? Or is there also a case for actually, no, it does work, it works just as well as any other remedy?
Yeah. So in my kind of personal experience, I don't really challenge their views. So like, I think challenging them, kind of, they just start kind of saying, oh, but I've been doing it for X many years, and maybe it does work, maybe it doesn't work, maybe it's a placebo effect, right? But I try not to challenge them as much with those kind of things, especially if they've been doing it for many years. But I do kind of show them that there are other things out there that could help, and kind of feed them that idea. And I kind of show them that through, for example, guide them through kind of meditation. Sometimes I just kind of get them to go through the mindfulness technique with the breathing exercises whilst I'm showing them different exercises, and kind of implementing that idea. So kind of drip feed that in. So it's difficult. I don't want to say, you should tell them not to do it, because again, it might be helping them. And with some patients, I know that they do carry on doing those kind of alternative therapies, and perhaps it does work. And I'm happy for them to keep doing it, as long as they're kind of also understanding that actually there may be other things they need to work on. And I would kind of more importantly focus on educating them on that and the importance of that. Yeah.
A question then that leads on to a question we always ask some of our guests is, the whole purpose of us starting the webinar series was to open discussion around the stigma that we know exists for South Asians and talking about mental health openly. So in your opinion, do you think that there still is a problem and an issue around mental health and being South Asian? Or do you think actually there are more open and active discussions around that now?
I think currently there are more open discussions, but the stigma still does exist, and you see a lot in the kind of the elderly communities, especially. So I think on one kind of positive note, like there is forward discussions, people are talking about it, but then there's the other part where people don't understand it, and I think it's difficult to just kind of go to them and like, you should see a therapist to do this, because often they feel attacked, right? They're like, why do I need to do this? And I think it's, if you do come across someone like that, it's kind of stressing the importance of actually treating your mind just like you treat your body. So if you've damaged your body, you would go and see someone who you think is going to help you. But if you feel like you're stressed, overwhelmed, often we just kind of hold it in. And especially during lockdown, I've noticed like there are a few more increase in suicide, especially like amongst Asian people, I've noticed. So especially these times, I think it's important, the importance of kind of reaching out to people that you may know, offering kind of alternative therapies, or even reaching out to them and just talking to them, see how they're doing, and reaching out to them and telling them the importance of actually reaching out to other people who may be willing to listen to them and willing to listen to their worries or stresses. Because actually what I found is when people aren't talking about their worries or internal conflicts or things that they're stressed about or anxious about, they hold it in so much, and it gets to a point when it's just so overwhelming, and that's where like it can lead to depression, lead to suicide. So yes, to your question, the positive thing is people are actually now creating platforms online for people to reach out, but at the same time there is still the stigma around. And I think if you come across someone who you may feel doesn't want to get that help and they may need it, it's not forcing them to get that help, but maybe sharing them a personal story of yours where you've kind of sought help and how it's helped you, or just sitting there and listening to what they may have, what stresses they may have.
Just leading on to from what you were just discussing, you've kind of half answered it anyway in your response earlier, to kind of dispel this myth or this taboo around talking about mental health, and the different, I suppose, like the different types of mental health we've got as well. How would you go about tackling it or dispelling it? It's a little bit of a broad one and it's a little bit of a hard one, but you have touched on it as well. So I don't know if you can just expand further onto that.
As in how I would help?
Yeah, or any suggestions you would have, or yeah.
I can only, I guess, give examples of what I've done or like what I've known people have done. So I know there's platforms out there where you can actually reach out to people who are like willing to talk to you and listen to you for help. And the therapists out there actually at the moment who are giving out free counseling sessions. So if anyone's interested, I can give out names. But yeah, again, like there are people out there willing to listen and willing to kind of go through that process of listening to you and sitting there and trying to understand where you're coming from, because often when you're going through those situations of anxiety, you feel like no one understands you. Especially if I give an example of back pain, where many patients come in and they feel like no one in their family understands their pain. So they'll say it's back pain, but their families may be like, oh, it's just back pain, just get up and go. But this back pain might be really serious where they've had it for 10 plus years and people just dismiss it. So if you're going through those kind of scenarios, it's really important to actually go and seek a professional who will understand you. And I think it's giving that message. If you have a family member going through back pain, rather than dismissing it and just saying, okay, just carry on, do this, apply some Vicks, take some paracetamol, rather than kind of just saying that, kind of maybe directing them to someone who may be able to help. And two, kind of opening up conversations online. Perhaps if you've gone through kind of anxiety or stress in your life or depression, just talking about it and sharing it. And I think it's a difficult thing sharing it online because some people think you need to be really have overcome that anxiety, overcome that depression to be able to speak about it. But I think at the same time, if you're going through that process, just being able to share it online, and have people reach out to you that way can also be supportive.
No, yeah, I certainly agree with in terms of what you're saying. I know people come and share their journeys, through their own social media. They've just put the story out, and I suppose it's almost like because they're not the only one that's going through that. Someone else is going through that, and they can always relate back to them, and it kind of, I suppose, it gives them that strength as well to kind of be like, okay, you know what, I'm not the only one that's going through this. I'm not the only one that suffers. And even if the person who ever shared it, they sometimes give, like, I know some people have said or what they've used or what they've done to help them overcome it as well. So it kind of helps that individual. So I agree with what you're saying there in terms of, sharing your story if you've been through something like that yourself.
100%. I think like if any kind of journey, even if you're going to see a therapist, kind of the first step is always to talk about it, right? The moment you can kind of talk to someone about it, all of a sudden it kind of creates that kind of pathway for you to actually accept it, perhaps, and be like, actually, I do have this pain and I might need help. But if you're always bottling it in, it's hard for you to take that first step. So I always think like the moment, even if it's a family member, just listens to you and you kind of, and they agree, like, you've got this pain and they accept it, and it helps you accept it, and then you can take that first step to actually seeking help.
Yeah, Jags, I have another question for you. So in terms of when people go to see a therapist or a psychologist, or in your case, a mindset coach, the idea is sort of to go to them for a certain amount of sessions, and then almost the therapist has to sort of make themselves redundant in a way. So basically they can go away and take away skills that they can do themselves. So, for anyone that's listening, would you have, I know you mentioned earlier breathing techniques, would you have some, 2 or 3 simple things that they could do at home, or if they ever felt as though, they're at home, especially now in lockdown when you can't really go places, and people might have a fear of going to visit a therapist or go visit a mindset coach, or even, anyone at the doctor at all. So do you have any sort of, like I said, techniques that they could sort of do at home?
So I guess mindfulness, like meditation, is one of them. I know it's difficult, like for some people. So I guess to begin with, journaling is a great way to start. And I guess when it comes to journaling, people often think, how do I do this? Do I start like Dear Diary and just carry on? Like, what do I do? I think the best way to approach journaling is if you've had a bad day, a really stressful day, literally open a piece of paper and just be like, start with, I'm frustrated because, and then maybe maybe someone shouted at you, so you just write, I'm frustrated today because my teacher shouted at me, and then you just kind of carry on from there. So it's almost like you're doing it intuitively as opposed to really thinking about it. And the idea is you just carry on writing whatever comes up for you without judging it, without thinking about it too much. And then at the end of the like, whenever you've got all of it out, have a relook, see what's there, or you can just kind of put it to the side, but at least you've got it out of your mind. Because often when it's in your mind, you're trying to connect one dot to another, and then you're going from one emotion to another, and it's really kind of confusing, and it can just make you more muddled up and more anxious. So if you can get it on a piece of paper, get it all out there, even if it doesn't make sense, even if it's in random orders, at least it's out there and not in your head. That's one. Two is walking can also be seen as a meditation. So just walking, preferably like in nature, helps. And just walking, paying attention to what's around you, paying attention to the steps you're making, and an hour or two outdoors and not in the same room can help. That'll be number two. And number three is, so almost like a meditation, you're basically looking around your room and you're focusing on picking out 3 things you see, 3 different colors, 3 different objects, and then paying attention to them individually. And that's almost, again, taking attention from you focusing internally to externally, and that can also help ground you.
Okay, great. Thank you, Jags. Vina, did you have another question?
Yeah, just following on from what you said about journaling. I know you said to journal on those frustrated days, so whatever you're feeling, to get it out there. But would you suggest only doing that on those days, or would you recommend doing it on just generally anyway, as an everyday practice, or how often would you want to do it as well?
I guess it depends on the individual. Like, I know like doing it every day can be difficult, and you may not have things in your head every day. I would I would start doing 5 minutes every day just to build that habit. So that, you know, when days do go hard, it'll be easier for you to pick up that journal and, you know, just jot it all down. One tool that, you know, I would recommend is like focus journaling every day on 3 things you're grateful for. Especially at the end of the day, just focusing in on 3 things that went well, what you're grateful for, but not just writing it down, but also kind of feeling how it felt to be in that moment, if that makes sense. If you're grateful for because someone complimented you, for example, you can kind of take a deep breath and kind of visualize yourself in that moment, and bringing up the experiences that you felt in that moment. So did you feel happy? Did you feel just quite content with yourself? And kind of also writing that down as well. So I guess a 5 minute practice every day of just writing down 3 things you're grateful for at the end of the day, and then building that up so that you can start writing about stresses and like things that make you anxious as well will help. And it's not an overnight thing, so it does take time, and over time you will start to see patterns emerge. So certain things might trigger you, certain things might make you more anxious, certain events might make you more anxious, and it's just a gradual learning process.
Cool. Manish, did you have one?
Yeah, Jags, how would you teach mindfulness to children?
To children, yeah. From my experience, like, children actually pick it up better. I don't know if that's just they listen better, um, but essentially, I would, um, from my experience, I would bring it in from a guided meditation way. So, like from a visualization aspect. So there was a period when I was working with children actually, and we went to this kind of meditation where essentially they were lying on a carpet at this time. So it's like a yoga mat. So everyone would lie on a yoga mat, and you get them to close their eyes and start kind of taking the deep diaphragmatic breaths. And we'd get them to start visualizing that the mat can kind of start flying, like in Aladdin, where the carpet starts to fly. So we get them to do that, and we get them to say, like, you know, with each breath you're flying higher and higher. And that often works. So I think with children it's bringing the aspect of creativity and linking it to how it can be fun and how it can, why, you know, they'd value it, because at the end of the day, if they don't see a value in it, they're not going to do it. I think that's with anyone really. So it's almost linking how you can take meditation and make it more fun for them. Yeah.
Yeah, thank you.
Cool. Okay, so Jags, you mentioned some therapists that were, you know, giving resources, so free advice or free counseling. What we will get you to do is just pop their details, or if you know the details, you can just say the details now. If you don't, it's fine.
I know there's Divina Therapy, but I can, yeah, I'll put the details down below. I think it'll be easier after. Yeah.
Perfect. Cool. Okay, yeah. And thank you for joining us and sharing your insights on mindfulness and mindset around basic just injury and mental health and so on. So yeah, thank you for that, Jags.
No worries.